Good morning, everyone. Today we will be discussing why NSAIDs and AC inhibitors or ARBs should not be given in a patient who are having, let's say, acute renal failure, or especially in case of ARBs and AC inhibitors, not to be given in case of renal artery stenosis. So we will be discussing on that. So this is the basic unit of our glomerulus. So this is our efferent arterial, and this is the efferent arterial, and this is the glomerulus, and this is the PCT. So this is the basic unit. And now what we have to understand is that, so for NSAIDs, so NSAIDs, actually NSAIDs, they are like prostaglandin inhibitors. So they because of COX inhibition, the synthesis of prostaglandin is decreased, or let's say inhibited. And what we need to know is that the prostaglandin that are secreted, actually they act upon the afferent arterioles, and they cause it vasodilatation. So because of the prostaglandin, there would have been afferent artery vasodilatation, but and because of that, the GFR, it will be maintained, let's say. Okay, so it keeps the afferent arterial patent, and to maintain the GFR. But however, when you give the NSAIDs, the prostaglandin synthesis will be stopped or inhibited, and because of that, the afferent arterioles, they will constrict. Okay, so because of the constriction, so now you see, the previously the amount which it was going, now it is decreased. So again, the apparent blood flow will be less, so GFR will be again decreased, and it will cause further damage to the kidney. So this is the reason why NSAIDs should not be given. Now now we will be talking about AC inhibitors and ARBs. In case of AC inhibitors and ARBs, actually they act upon efferent arterioles. So as you know that AC inhibitors, so we know that AC inhibitors, actually they inhibit because of their mechanism of action, because of them, like uh, here, let's say when there is low perfusion, or let's say there is activation of the RAS because of hypovolemic state, or let's say for any case, and because of that, it will convert angiotensinogen 1 into angiotensin. Angiotensinogen 1 is secreted by the liver, and AC and when it goes into the lungs, it will be converted into angiotensin. And how the AC inhibitor, actually they inhibit the angiotensin converting enzyme. So because of that, there will be no production of angiotensin. And what we need to know is that the function of angiotensin is to constrict the efferent arterioles. Okay, so by constricting the efferent arterioles, actually the in normal case, the angiotensin, it constricts the efferent arterioles. So because of constriction, let's say because of ACE action, so this is constricted. Okay, so because of this constriction, here the inflow blood will be accumulated, or let's say the GFR will be maintained because of this constriction. Okay, so because of constriction, there will be accumulation, and effective filtration will be there. However, when we use ACE inhibitors, so you see that ACE inhibitors, it will act on ACE enzyme which is located in the lungs, and angiotensin cannot be produced. So because of that, angiotensin will not be produced, and because of that, there will be no vasoconstriction, whether it may further lead to vasodilatation. Okay, so it will be leading to vasodilatation. So when there will be vasodilatation, then because of lower resistance in this side, blood will flow quickly from efferent to efferent, so there won't be effective filtration. So because of that, again the GFR will be decreased. So AC inhibitors should not be used in case of acute renal failure. And another contraindication for ACE inhibitor is when there is, like, let's say, uh, renal artery stenosis. So this is our renal artery, and there is stenosis of renal artery. So you see that there is vasodilatation. Okay, so because of vasodilatation, though small amount of blood it was coming, that will again further go to this side because of lower resistance. So in this case, because of dilatation of the efferent arteriole, there won't be effective filtration, and the urine output will again decrease and cause insult to the kidney. So ACE inhibitors should not be used in case of hypovolemic state or pre-renal causes of renal failure, and not to be used in case of renal artery stenosis. Thank you.